Thanks to taxpayer aid related to COVID, most hospitals operated at all-time profitability in recent years, according to analyses. And yet more are closing down maternity wards. Lisa Fletcher looks into the problem, reporting from Pennsylvania.
Registered nurse Maggie Leister begins most days in the car, not to get to a clinic or hospital, but to go directly to her patients' homes.
Make a U-turn at Harding Avenue.
She's one of a small number of nurse home visitors specializing in new and expectant mothers. She covers Juniata County, Pennsylvania, a rural area an hour northwest of the capital, Harrisburg. Her job exists because so many rural areas have lost maternity wards and the obstetricians who take care of women during their pregnancy.
How many hospitals are there here in Juniata County?
There are currently no hospitals in Juniata County.
Across the country, rural maternity wards have been shuttered at an alarming rate. Around 200 hospitals have closed their obstetrics units in the last decade, leaving many expectant moms and people with serious medical conditions far from high-level medical help.
There was a hospital not that many years ago that offered maternal care out in one of the rural areas here, and it closed. What was the result of that closure?
So the women had to find care elsewhere, so that meant farther drives and probably not as good of care.
Hey, Selena. How are you today?
I'm all right.
On the day we met Leister, she drove 30 minutes to see her first patient.
Tell me how you've been kind of feeling with everything going on.
It's getting better.
Selena Hawk is 8 months pregnant with her first child. She grew up in a city, but came to the tiny town of Richfield a year ago.
What are some of the things as an expectant mom that you're worried about now that you're in a rural area that doesn't offer maternal care?
It's mainly if something were to happen, if my fiance's at work and like my friends that live downstairs from me aren't home, how am I going to get myself to the hospital?
For Hawk, it's a drive of more than 30 minutes to the nearest hospital, about an hour for one that has the care her high-risk pregnancy requires. The biggest factor in the closure of hospitals and maternity wards, declining rural populations and birth rates. Fewer than half of all rural counties now have a practicing obstetrician, according to the American College of OBGYNs. Of greater concern is the rise of maternal deaths in the U.S. That's when a woman dies during pregnancy or within 42 days of giving birth for reasons related to her pregnancy or care. In 2019, the rate was 20 deaths per 100,000 births. By 2021, the number rose to nearly 33 deaths. Experts attribute America's higher maternal mortality rates to a number of factors, including access to care.
For the women who aren't fortunate enough to have a Nurse Maggie come and visit them and they're in a rural area that's lost their maternity care, what is the bigger problem there?
Just timely care, are they being seen regularly? Because with maternity care, things can change so quickly. Blood pressures and diabetes and things like that. They can happen overnight almost sometimes. Okay, 110/82, perfect.
Okay.
So Leister is keeping a close eye on Selena Hawk as her due date approaches. For Full Measure, I'm Lisa Fletcher in Pennsylvania.